eventually due to her extreme,
Sorry.
okay, eventually, yep, that's okay. With her really extreme symptoms, and we had her at a psychologist, but due to lack of response after a really short period of time, the psychologist just reached out to colleagues on a listserv for psychologists in Pennsylvania, and somebody replied, "Have you considered pandas?" And we hadn't considered it. We didn't know what it was. But as soon as we looked it up and learned what it was really crystal clear that that was what was going on in her case. So I will be forever grateful for that suggestion. That was more than 5 years ago, and I have been learning all I can to help her and other families in my shoes since that time. With a group of physicians, some out at UCLA and some on the East Coast. We actually had recently published research this year, which, any research in the literature in the medical literature is just so great to get more doctors and more providers aware of PANS and pandas. We published research on the barriers to diagnosis and treatment. And I've also been able to give, grand rounds and lectures to local doctors here and to nurses and school teachers and the school nurses to try to educate more and more people. I really, like you guys probably agree, but I really don't think that PANS is actually that rare. It is just often missed and misdiagnosed. So this is just the official diagnostic criteria for PANS. I will move through this pretty quickly because I imagine that most of you are quite familiar with these concepts, and I think you've had other speakers talked about these things. I'm certainly happy to answer any questions about the diagnosis. As you are aware, the hallmark of this disease is the abrupt onset of OCD or severe food restriction. And of course, the abrupt is sometimes difficult to tell how abrupt it's been, especially in younger children. But plus the whole constellation of other neuropsychiatric symptoms, which are listed here, the anxiety, I'm not going to spend time on those tonight. I think it's really important to realize that pandas, is really an orphan in the medical world. There is no single area of specialists that has adopted it and taken it on as, to really take care of these kids. The care is at an intersection between mental health, immunology, rheumatology, infectious disease, and the care of this disorder crosses so many specialties, requires many ancillary services. And because of that, it's often taken care of by no one. No one's really that interested in it unless you can find somebody who spent a lot of time learning about PANS. And this to me demonstrates the relevance of an integrative medicine approach, one which addresses a problem holistically, looking for the root cause of the illness, targeting treatments, and having a multifactorial approach to wellness. So the diagnosis is very important to find all the underlying causes. We always need to determine if there are other autoimmune diseases, other infections, nutrient deficiencies, or toxic exposures. Sometimes it might be clear that, strep or one infection has really triggered this, but to have true wellness for these children, we need to address all of the other areas as well. So just to remind us all that any pathogen has the potential to initiate PANS. I think it's really important to remember to check all family members, especially for strep, but for other infections as well. I often find that a sibling who is sick or who isn't sick, a sibling who is just a carrier of strep is very often the cause of keeping the kid with PANS or pandas sick. So we need to look for Lyme, especially here in Pennsylvania, and all of the other tick-borne co-infections. Also Mycoplasma pneumonia, or a walking pneumonia. I suspect that sometimes more often if there's a chronic cough, but sometimes you can find it even without a cough. It also can result from influenza, Epstein-Barr, herpes, and now we are really seeing children emerging from COVID with PANS. So this is another new cause. And as sad as that is, I actually think that it is opening up the research a little bit more and opening up awareness of these conditions more. I was at a 3-day conference last month, a month or so ago at Georgetown, put on by Georgetown University. And there was a lot of discussion of COVID as a cause. So PANS is an autoimmune disease where autoantibodies incorrectly attack the brain. And this creates inflammation and dysfunction in the basal ganglia. And I'm just showing you this slide briefly so that you can have a feel of, where and what the basal ganglia it is. So it's an area in the center of the brain, and understanding the function of this part of the brain, I think, can really understand the behaviors and symptoms that we see in kids with PANS. And from studies, researchers have shown that we do see changes on MRIs and PET scans. Of course, just in research purposes, it's really not available for clinical use, but there are changes in the size of the basal ganglia. There also are these things called microglial activation in that area, which shows us that there's inflammation. And we can also find specific antibodies, which can be measured, and they specifically target the basal ganglia. Those are the antibodies that are measured in the Cunningham panel. So when we look at the function of the basal ganglia, it is not surprising how inflammation in this area may lead to the symptoms and impairments that we see with kids with PANDAS. The basal ganglia is the relay station through which neurons run that control mood, emotion, procedural learning, motor movements, cognition, and sensory processing. So really we're looking at PANS as a post-infectious basal ganglia encephalitis. And that name really more clearly defines the etiology of the condition. Maybe some of you have been on conferences where Susan Sweeto has talked about, she wishes she hadn't named it PANS and PANDA. She wishes she had actually named it a post-infectious basal ganglia encephalitis, which would really more clearly define the etiology of the condition. And I find it really helpful to remember what the basal ganglia does to see the problems that we end up seeing in these kids with the OCD and mood lability and anxiety, rage, handwriting changes, clumsiness. This all comes from that part of the brain that is controlling these areas. And then that helps to guide the integrative approach for each of these areas of impairment. So although there are many modalities and techniques that can be used, the options are really endless, but I have chosen these areas, which are primarily mind-body techniques and also nutrition, to discuss tonight. So we're going to look at these things that are shown here. And so I think I skipped a slide, just a second. Yeah, I jumped ahead 2 slides. Okay, sorry about that. So I wanted to begin with looking at emotional regulation, which is a really core function of the basal ganglia, and therefore a core dysfunction in PANS. So the vagus nerve is the longest nerve in the body, and it runs from the abdomen to the brain, or it runs from the brain to the abdomen. It actually goes both directions. It has efferent and afferent nerve fibers. So you can affect it by either changing in the brain or by changing what you're doing in the body. And when the vagus nerve is stimulated, it activates the parasympathetic nervous system. The parasympathetic nervous system is the rest and digest system. This is the exact opposite of the sympathetic nervous system, which is the system of fight and flight and freeze. The fight, flight, freeze is the sympathetic nervous system. That is what we see overactive in kids who have PANS, especially during a flare. You are likely familiar with the deer in headlights, glazed over look in their eyes when they're in a flare, the almost wild animal-like quality that just makes it so hard to communicate with them, to reach them, to even engage in any way. This is an overactivated sympathetic nervous system response. And we can actually counter that by activating the opposite system, the parasympathetic nervous system. And we can do that by stimulating the vagus nerve. So in the center of the slide, in the center of my pictures that I have on there, I have a book there called Accessing the Healing Power of the Vagus Nerve. And this is a great book that you could take a look at to learn some techniques to stimulate the vagus nerve, but some really simple techniques you can also start to use right away. One is doing deep belly breathing or doing diaphragmatic breathing. And some of these things, when we're talking about something that's so serious and so complex as PANS, some of these simple techniques, though, actually can make really significant difference in kids' lives. So to do diaphragmatic or belly breathing, you just place one hand on the chest and place another hand on the belly, on the abdomen, and then inhale slowly through the nose and feeling the breath go down through the nose, through the throat, through the chest and into the abdomen, and allowing the diaphragm to expand as if there's a balloon in the belly. And when you expand the belly and the diaphragm like that, it stimulates the vagus nerve and it allows for relaxation. Also, by bringing the breath into the lower part of your lungs, that's where the greatest proportion of parasympathetic nervous system receptors are. And so when we activate that and stimulate that, we can cause relaxation. It's easiest to have children learn this technique and to practice it while lying down. There's lots of YouTube videos that you can watch to show how to do it, but it works pretty well if you have them lie down, and especially if it's a younger child, put one hand on their chest and then put like a little stuffed animal on their belly and have them take deep breaths and let their belly rise and lift the stuffed animal up and down as they're breathing, and they can watch it. And then once you've learned to do it that way, you can learn how to do it standing up. You can do it, and doing this for just 1 minute will dramatically change the mood and the activation of the nervous system. So I also have some little pictures there of yoga figures. So you can exaggerate this deep belly breathing actually while doing it during a forward fold. So either while seated on the ground and with the legs out straight and bending over forward and doing a seated forward fold, or you can do it while standing up and then, letting the knees bend slightly and inhaling, and then as you exhale, falling over forward, just have the child bend over. You can even do it in a chair, leaning, put the head down between the legs. And then while you're in that position, you do the deep belly breathing. And it can really be helpful. So these breathing techniques, of course, need to be practiced regularly. Like when a child is not having a flare, we certainly can't try to teach them this in the middle of a horrible outburst or, in the middle of a tantrum or a very aggressive, violent time that they may be having, but you can teach it in between flares and when they're in a calmer state so that they can then utilize that skill when it's needed. And you can teach this to even very young children, and really helpful for older children and teenagers. So there's a few other techniques that I wanted to mention that also stimulate the vagus nerve. And one is just using ice and cold. So when, we even have thought about, you've heard of people for years and years, if somebody's upset, you'll splash water on the face. It actually does work. It makes a difference. So I'm not suggesting you do that to your child, but you can ask them if they want to do it. If they want to go to a sink, splash a little cold water on their face. Or I've had many children who like to take a shower or a bath, and using like a cool shower, splashing on the face will stimulate the vagus nerve. And a simple technique that I find really useful is giving a child a popsicle. So I have these little Annie's pops up there, but using some sort of popsicle or ice cream or something and putting it into the mouth and having the cold on the roof of the mouth will stimulate this relaxation parasympathetic nervous system response. And we'll talk a little bit or quite a lot about nutrition, but using like a healthy frozen smoothie that you can make, especially even if a child's in the middle of a really difficult experience. Sometimes they're that way because they're too hungry and they haven't eaten, but they're so over the top, you can't even get them to get any food in. But sometimes you can make a frozen smoothie, maybe with frozen bananas, blueberries, almond milk, and then, try to get them to have that through a straw. And drinking something cold like that through a straw can sometimes be really useful in some very difficult, tough moments. And then let's see, I also have listed here Heart Math. And Heart Math is a free website that you can visit. Heart Math is a really strange name for a wonderful technique that helps to increase heart rate variability. And heart rate variability is an indicator of a person's relaxation. It's really an indicator of the activation of the parasympathetic nervous system. So they have all these great tools on there. The one that I have the little picture of here, that's just it's an audio program that you can listen to. It runs about 5 minutes long. But it actually teaches some of the relaxation breathing techniques and talks the child through other things that can be useful during a difficult moment. So all of these techniques help to counter the sympathetic nervous response and help with, they also help with sleep. So I'll go into sleep next. I'm going to pause for 1 second. I see that there's some talking in the chat. I can't see the chat while I'm presenting. So let me just check on those. Okay, yeah, so people, okay, great. So somebody said offering cold pops has worked really well during rage events. And somebody else is saying that they're using ice packs on the back of the neck. Great, that's fabulous. And yeah, these things, and that's how they're working. That's why they're working. They're really relaxing the sympathetic nervous response. So let's see. So all these things can help with sleep. And I want to move into discussing sleep next. So children who have PANS have really a lot of sleep disturbances. This is one of the most difficult parts. It's so hard for parents. It's so hard for families and siblings and everybody. It's just living with poor sleep, and the poor sleep affects the child's health as well. How can they get well when they're not even getting enough rest? So the studies show that children with PANS have very, very high rates of fatigue and also very disrupted sleep. So as a lot of you are probably aware, the children who was previously sleeping through the night on their own is now unable to fall asleep. They may insist on sleeping with parents. They may not be able to sleep at all. They can't sleep in their own room. They want people to sleep with them. Of course, a lot of the separation anxiety goes along with that as well. When you study these kids with sleep studies, they very frequently have insomnia, nightmares, and very restless sleep, a lot of times with reversed sleep cycles where they're sleeping during the day and awake at night. And if you do a sleep study there's been a few studies in it, kids with the study was specifically in pandas, but 87% had abnormal sleep studies, which is just really high numbers. And 80 to 85% of those show something called a REM or an REM behavior disorder. It's called REM behavior disorder, which is kind of a weird name for it. It actually means that while the child is sleeping, or while they're dreaming, I'm sorry, and that's what REM sleep is, while you're dreaming, that the child actually moves. They have movement of their limbs and their body. And when we are in REM sleep and we're dreaming, the body is actually supposed to be paralyzed. And this is very rare to see in other conditions. If you do sleep studies in people with Parkinson's, you see the same dysfunction. And that is really fascinating to me. And because, Parkinson's also affects the basal ganglia. So it's the same part of that brain. And we're seeing the same problem in sleep studies. So some ideas, let's see, let me go back again. So what we were discussing earlier, using all of those techniques can be really helpful at bedtime, especially the use of the different breathing techniques before bed. And sleep hygiene is really a key. It's very, very hard. I know that we're like struggling so much to get these kids to bed, but as much as possible using sleep hygiene, and that's kind of the word used with sleep specialist circles. And it really just means creating a very regular, consistent bedtime routine that has a consistent bedtime, so time that we're getting ready for bed and going to bed, and then consistent times of waking up too, even on weekends. So trying to go to bed at the same time every night within like 30 to 50 minutes, and trying to get up the same time every day too, including weekends, because it can be really disruptive to the sleep cycle. And also to create a soothing bedtime routine where we are using maybe some of these meditation techniques, some bedtime yoga. You can watch YouTube videos to teach really simple bedtime yoga routines to children, and you can find them that are appropriate for all different ages and for parents we're all having trouble sleeping because our kids aren't sleeping. So this is helpful as well. And then creating a dark and quiet environment, using noise machines, using earplugs, and using some meditation at bedtime. Also avoiding caffeine altogether for children with PANS, and avoiding screens for at least 2 hours prior to bed. Something that isn't really an alternative medicine, it's really more conventional medicine, but I think it's missed a lot in kids with PANS, is looking for obstructive sleep apnea. So seeing if we have signs of mouth breathing or signs of child snoring at night. Night terrors and nightmares can also be signs of obstructive sleep apnea. So that's where the tonsils are too large and inflamed, or the adenoids are enlarged and inflamed, and either these need to be treated with approaches for allergies or toxins, but also sometimes they just need to be removed. And as you may be aware as well, sometimes having the tonsils and adenoids removed is also a treatment that works for some children with PANDAS. So always looking for that. And then there are supplements prior to bedtime that can be helpful. A lot of kids do well using some melatonin. Melatonin doesn't cause any drowsiness or sedation. It just allows the brain to fall asleep. Tryptophan can be used, and chamomile can be used as a tea, which is very nice. L-theanine supplements can be used, and lavender essential oil can be, drops of that can be used in a carrier oil and used on the neck or on the wrists is a great area. I really love this cream that I have an image of here called Mag-Soothium. It has magnesium and arnica and also lavender in it, and that can be used. You can, smooth it over the child's legs. A lot of these kids are in a lot of pain, have a lot of body pain and body symptoms, and that can help that too. So you can soothe that onto them at night, and it has multiple purposes. If you are using melatonin, it should be given about 30 minutes prior to bed. And I do like this product here that I have shown. Oops, let me go back again. This is Sleep Tight by Little Da Vinci. And I'm certainly not like encouraging any of these. As I started to put together the slideshow, I thought people would probably ask about products, and this was a way to kind of just give some ideas. But that is a liquid, and it's really nice. It's a sublingual liquid, so you just squirt it, or the child can squirt it under their tongue themselves, and you don't have to wait for it to go through the digestive system. Also, a lot of kids have digestive disorders, and so you don't have to worry about whether it's absorbed or not. Sometimes using a bedtime journal where you're putting down all of their worries, like having a book that, either the child themselves or with the parents or the caregivers, you can, especially if the child's having a lot of phobias, a lot of anxiety, a lot of things that they're afraid of. And this is a great technique for adults too. I do work with adults a lot as well, and we use this a lot for adults. So it may be better even for the young adult population or our teens. But all the things that you're thinking about, you just write them all down and gets it out of the head, and then set that aside and before trying to go to sleep. So part of the bedtime routine can sometimes be a bath. And if we are doing that, then I recommend using Epsom salt, which is magnesium sulfate in the bath. And I have a whole slide on it because it's so important. So Epsom salts can be added to the bath. Magnesium is a really wonderful mineral. It is often very deficient in many people, but especially in children who are having these types of difficulties. The magnesium can ease sore muscles and helps with relaxation and sleep, and also with constipation. So oral magnesium can also be really helpful. You can use a magnesium citrate, which is available in lots of powdered forms that can be used for younger children. There's one brand called Calm that can be mixed with water, and then you can really titrate the dose that's needed for individual children, or you can use capsules as well. But doing the bath is a really great wind down activity that also helps to bring relaxation. And when you use Epsom salt, magnesium sulfate in the bath, it also helps to naturally increase the production of glutathione, which I'll mention a little bit later, but glutathione is an antioxidant that is really helpful for detoxification, and also it has anti-inflammatory properties also. So, endless studies show the benefit of physical activity for children. Physical activity helps control aggression and outbursts. So, of course, I'm not talking about studies that have been specifically done in PANS kids. There are studies that have been done in children with ADHD. And since we see so many similar characteristics, we can take a look at those studies as well to help us find other techniques and useful ways to help our children with PANS. Exercise helps to control aggression and outbursts. It can counter rigidity and compulsions, helps with focus and concentration, decreases intrusive and unwanted thoughts, and decreases worry and anxiety. And the exercise can really be anything at all, anything that you can get your kids to do. Martial arts classes, a lot of families find really, really helpful. There's a lot of kind of meditative, mindful relaxation techniques and breathing techniques that are used in martial arts that can be carried over to their life. Running, walking in the woods, hula hooping, jumping on trampoline. There's lots, as a family doctor, there's lots of other reasons not to jump on a trampoline, but it can be really helpful for kids who have a lot of extra energy. Swimming can be a really great activity, especially for children who have like a sensory processing disorder type of picture. So many of our PANS kids have hypersensory activity, and swimming seems to be so enjoyed by children who are overly sensitive. So anything that you can get them to do and as much as possible, trying to make it happen every day, as much as you can, participating with them, getting other family members involved, getting friends involved, joining group activities, whatever you have to do. I mean, if there was, when you look at these statistics here, if we had a drug that could increase attention by 89%, you know, it would be prescribed by everybody all the time. And we just don't have anything like that. But just that specific study was done, and they did a little after school program that did 30 minutes of exercise after school. And it was a long study. They did it for 6 months, but at the end of 6 months, those kids had these just remarkable changes. So it's something to, even though it's a simple thing, it's something we all have access to, but it's really important to try to remember. So mindfulness, or some mindful meditation, has also been studied quite extensively in the ADHD population, and with just 2 months of regular practice. And in these studies, the regular practice was only 10 minutes of meditation, and it wasn't even done every day. It was 10 minutes of meditation that was done most days. And they had just remarkable outcomes. It has incredible improvement of mood and math scores. And so many of our kids with PANS and PANDAS have academic and cognitive decline. And the area of math is often specifically affected. And also the kids are just happier. The biggest thing with mindful meditation is that it decreases reactivity. So it allows for a moment of pause before reaction. And this is something that when you're in a chronic state of overactivated sympathetic nervous response that our children just don't have, you know, it's this impulsivity. They're just doing things without being able to take a moment and think. They are being very reactive instead of responsive. And some mindfulness will help to increase that responsiveness, and also decrease the emotional ability. So the up and down mood swings, the emotion that's just all over the place that we're so used to. This book is wonderful. I actually read this book long before I had a child with PANDAS, and but I've continued to find it useful. A couple apps that are great are Insight Timer and Headspace. Insight Timer is free. It is my most favorite app. I've been using it myself for, I think, 12 years now. The only problem with Insight Timer is it has increased so much that there are just too many choices now. But you can do a search on Insight Timer for children, and you can search like anything. You can search children's bedtime, and you'll find lots of nice meditations that are guided imagery that talk children through relaxation and trying easing. They're useful before bed. They're also really useful sometimes to start the day, or after school, in between activities. Another study had shown just something that's really so amazing to me, is that if you can't get your kids to do mindful meditation, which I actually can't get my child who has PANDAS, my older child who has other issues, she's willing and will do meditation, but my other one, I just can't do it. So I know sometimes you can't convince them to do things, but they've done studies that if the parents do meditation themselves, it actually leads to calmer children, and hyperactivity decreases in the children when the parents do meditation. And again, mindfulness is something that needs to be practiced when you're not in the depths of a flare. This needs to be practiced when you're in between flares, or at least when you're in between big outbursts, and then you can use it later. And try to make it a regular part of bedtime and prior to meals, even like 1 minute before a meal. If you're able to sit down as a family and eat, and you can take 1 minute to slow down, stop for a moment, and just be aware of the present moment, either watching the breath for a moment or two, or just being aware of the body in space. And let's see, I don't see the chat popping up any longer. Is there any thing popping up right now?
No. And we can
No.
also chat at the end.
Okay, great. So the underlying cause of the behavioral changes that we see, inflammation in the brain. So treating the inflammation is really a big keystone of treatment. So we, in an integrative approach, we use the conventional treatments like the NSAIDs, Motrin, Advil, ibuprofen, all of that. Also steroids, IVIG when needed, and other immune modulating therapies. But we can also use nutritional supplements such as glutathione and NAC, which is N-acetylcysteine, which are really useful antioxidants. Curcumin can be given as an anti-inflammatory, and it can also help reduce the risk of stomach ulceration, which comes if we ibuprofen or other NSAIDs, naproxen, any of the NSAIDs that can cause ulcers and stomach irritation. And we also need to decrease inflammation by getting rid of toxic exposures such as mold and avoiding preservatives like sodium benzoate. Sodium benzoate is something that is in so many foods and products. It's a preservative that's in a lot of liquid medications. It's used in Tylenol and in ibuprofen. So often the way around that is if you can use chewables or if you can use capsules that can be swallowed or tablets that can be swallowed. So sodium benzoate has been studied and it causes very significant hyperactivity. It only does it to about 15% of the kids. It's one of those things that it either happens or it doesn't happen. And so, you can benzoate becomes benzene when it's metabolized by the body, which is a carcinogen. So it would be great for everybody to avoid it. It can lead to headaches and agitation and irritability and hypersensitivity reactions. And it's often in a lot of liquid foods, like a lot of liquid drinks and other things that come in liquid. I put here just a thing of pickles. You can find pickles that don't have sodium benzoate. I would encourage people to start reading labels on everything. And if you see sodium benzoate, to not use it for your child or for your whole family. So we're really trying to do everything that we can to remove any sort of things that are inflammatory from the child's environment and also from their diet. So I have a picture here of some stainless steel pots because things like Teflon in nonstick pans. And I mean, it's just endless, the things that can be inflammatory in our environment. But as many as we can get rid of, then the fewer triggers and the fewer stressors on our children's very vulnerable brains. And so the anti-inflammatory diet is something that is very, can be really helpful. I put a food pyramid here. This is, I'm sorry, get back to that. So this is not the typical food pyramid that you've probably seen in your health classes at school and that your kids are seeing. This is a food pyramid that is the anti-inflammatory diet, which is what Dr. Andrew Weil talks of. He was my main mentor and the head of our integrative medicine program. And I've also done a certification through Cornell in whole food plant-based diet and anti-inflammatory foods. So I know this is really hard to follow a diet like this, especially for the kids who have PANS and who often have significant food restriction and are really picky eaters. But as much as we can do it for ourselves and our whole family and to try to keep introducing foods, we can make a difference. So the diet changes, again, are most important to make in between flares when your children may be more receptive to these types of changes. And it really is a lifelong family-wide process to try to shift the body away from autoimmunity and towards health. And we know that we've talked about We know that PANS and PANDAS are autoimmune conditions. And when you have one autoimmune condition, you are so many times more likely to develop another autoimmune condition. So if we have PANS or PANDAS, we can develop type 1 diabetes and Hashimoto's thyroiditis and rheumatoid arthritis and lupus. And, the list just goes on and on. And so by addressing our diet, we can actually reduce those risks. And so I would suggest, just considering it. I know changing the diet can be one of the most difficult things to do in a family. The anti-inflammatory diet, its base is with fruits and vegetables and whole grains. And then there's also use of healthy fats, nuts, especially walnuts and seeds and avocado, and then fish, like especially salmon and herring and sardines. A lot of soy foods and mushrooms. The mushrooms have to be cooked. Uncooked mushrooms are very highly inflammatory, actually, but cooked mushrooms are fabulous. Uncooked mushrooms are bad. And then limiting dairy. We know that dairy is highly inflammatory. Lots of studies show links between high intakes of dairy and type 1 diabetes in children. And, this is really tough. I live in northern central Pennsylvania in the middle of dairy community. So it's hard to talk about limiting dairy, but to this population here with kids who are so suffering from these problems, I would really, think about limiting dairy. You can use dairy alternatives, different types of milks, as long as the children aren't allergic to almond and flax, soy, oat milk, all the other alternative milks. Also skinless chicken, ideally organic or, coming from good sources, lots of herbs and spices, which have lots of anti-inflammatory properties, and using green tea as a beverage, and lots of water. So yeah, again, just kind of running through the same things we saw in that pyramid. And so that was showing us what to eat. I'll just mention kind of what to avoid a little bit more. So really avoiding processed foods, especially foods with nitrates and glutamates in them, which can be really neurotoxic and excitatory to overstimulate an already vulnerable and overstimulated brain. Using organic as much as possible. And I know organic choices can be so much more expensive. So looking at the Dirty Dozen, which shows the 12 fruits and vegetables which have the highest rates of pesticides, and especially for those foods, trying to eat organic as much as you can. And then just reminding to make sure that these kids have frequent meals and not letting their blood sugar get too low, because that can often trigger off an event, and avoiding preservatives. And again, I'll mention sodium benzoate because it's so important. And as much as we try to get them to eat, really healthy meals, I know it is so hard. So I do suggest especially if you're going through a period of time where the children are having a lot of, where you can't get anything that is healthy in them, or really even any food at all at times, I recommend trying to supplement at those times, certainly giving multivitamins, like good multivitamins that have everything that's needed, and then also using protein shakes. These are just a couple brands that my family has enjoyed and that we like, Kachava and Owen, and they're both plant-based, so they don't have dairy, they don't have the casein protein, which can be really allergenic to a lot of kids. And then this other product on here is called Enough. And of course, I should do a disclosure. I have no financial interest in any of this. It's just things that I have found useful myself. Enough it looks big there. It's actually like a really teeny little bottle. It's like a little pepper can, but it's very concentrated forms of vegetable. And You just need a really teeny amount. And even in kids who I've dealt with who have like really severe food restriction and ARFID and like just don't like the taste or the texture of anything, sometimes that's something that you can get them to take, that you can sprinkle on to something that they like, whatever it is, you know, applesauce, pudding, ice cream, whatever it is. So and sometimes, you know, making smoothies and being able to add supplements and adding things to smoothies can be really helpful, if you can get, if a child likes them. So magnesium is my most favorite supplement. It can help PANS children in so many ways with sleep, relaxation, pain reduction, constipation. And I believe that every kid with any mental health diagnosis really needs more magnesium. When it's low, it can imbalance the dopamine and serotonin neurotransmitters and leads to, you know, poor concentration, anxiety, mood swings, sleep problems. Also, children who are taking psychiatric medications, those medications can make magnesium, can create a magnesium deficiency. And sometimes we'll see kids started on stimulants and they'll get tics. If they didn't already have tics as part of their PANS, they'll develop tics. And sometimes those tics can be stopped by giving magnesium. Doing blood tests for magnesium is just not useful. I don't you know, it doesn't help at all because most of the magnesium is not in the blood. It's actually in the cells within the body. You can test with hair, but I don't ever do it. It's not that useful. Most people just need the magnesium supplement. It can take up to 3 months to see a difference. You can try to increase magnesium rich foods. I really like to use food as medicine before giving supplements. But again, when we're dealing with kids who have a lot of food restriction, sometimes supplements are easier to get in. So you can, you know, try to use dark chocolate, leafy greens, whole grains, beans, and nuts, and otherwise using it again in the Epsom salt baths, the topical, you can use sprays or creams, capsules or powders to drink. Iron deficiency is another really important nutritional component. It is very, very common in children, and it is more common in children who have hyperactivity, anxiety, and depressed mood. And these types of symptoms can really be additive and make the PANS and PANDAS symptoms worse. So low ferritin, and ferritin is a measure of iron stores. This is found in with very low ferritin in children with Tourette's and children with tics. And often, you know, I think it's like a misdiagnosis. The child is really just iron deficient, and with their iron deficient, they're having tics. And if you can treat the iron deficiency and get their iron levels up really high, you can sometimes make the tics go away. We see it in adults who have restless leg syndrome. If you've ever experienced that, a lot of women in pregnancy experience it. And again, it goes along with low iron levels that we see in pregnancy. And if we can increase the iron, we can make the tics go away, and we also improve the mood. So you can try to increase with iron-rich foods. You can also use something called the lucky fish, which is like a fish that's made of iron, and you actually just put it in pots when you're cooking. So if you're making soups or anything that's in a pot, or you can put it into water and you can boil the water and then let the water cool, and you can use that water. And then you have water that has high levels of iron, and cooking with cast iron pans can do that too. But almost every kid I see with PANS and PANDAS, I check their iron level, and I haven't seen any that's high. The blood test, the regular doctor will often say, oh, the ferritin's normal, because normal on a routine blood screening is down to 12, but 12 is really not normal. It should be up around 40, and I prefer to see it up around 60 to 70. When you're treating adults with restless leg, we don't see an improvement in the restless leg until you get up to levels of 60 and 70. So I use those same types of guidelines because we don't have any other guidelines for this, but it's something really worth asking your doctor to check your children's ferritin levels. So lithium nutritional lithium. So this is lithium orotate. It's not the same type of lithium that you use for bipolar disorder, or that you may be used to, and some children may be using it for that purpose. But this is just the lithium that is naturally occurring in our ground and in the water. And it can have a very dramatic positive effect on mood, especially children who are highly irritable, who have a lot of aggression and a lot of anger. It seems to make the most difference in those. Those are the children who I think about using it the most. There have been Ritalin in children with ADHD, and it works better than the Ritalin. So it's really, really safe. You use teeny, teeny, tiny doses, like 1 to 2 milligrams, sometimes up to 5 to 10 milligrams. But it's something worth considering. If you're considering lithium, I definitely recommend taking a look at this book, Finally Focused. It's actually all about ADHD, but you'll see that so many of these symptoms and so many of the behaviors that we see are so similar. This book is written for parents. It's very easy to read. It has like step-by-step guidelines. It's really wonderful. So we also need to look at levels of zinc and copper. Zinc, it's very easy to become zinc deficient, especially when you have food restriction, which so many of these kids have. Picky eaters are notoriously low in zinc, and it's a very cyclical problem. Having low zinc actually affects your sensations of taste and smell and makes things taste different. And so it perpetuates picky eating. We see really low zinc levels in people and children who have anorexia and ARFID. And sometimes if we, improve the zinc level with zinc supplements, we can really improve the food restriction and they start eating better. So you can either just begin supplementing with zinc. It's great for immune system as well. But it's often best to test levels. You can red blood cell levels of zinc that we test in just regular blood tests are accurate for zinc. Although they're not for magnesium, they are for zinc and for copper. So you can test those. You can also test them in hair, but I don't ever do that because, the blood levels are easily paid for by most people's insurance, and the hair, of course, never is at all. So vitamin D is also really important. It's important in immune function, and but now vitamin D is something that I actually, most of us in Pennsylvania are going to have low vitamin D levels. But if you have been using a vitamin D supplement, it is important to check levels because sometimes it can get up to toxic amounts. It's really important in immune modulation. One of the studies at the Stanford group, the PANDAS Stanford group, they showed low vitamin D levels in children with PANDAS, and that with supplementing with vitamin D, they were able to decrease PANDAS. So very, very important. Again, you want the levels pretty high. Like the normal labs may say that around 20 is normal, but really you want to get up to 40, 50, 60 to have the optimal level. Vitamin D always needs to be given with fat. It is a fat soluble vitamin. So if there's no vitamin D, if there's no fat at the same time, it won't be absorbed. And there's lots of ways to give it. I find these drops super easy. They are basically tasteless. Kids don't even notice them. Omega-3 fatty acids, super important as well. They add a lot of strength to the brain cells. They decrease inflammation in the brain. And when the levels are low, it degrades the blood-brain barrier. And if you remember the mechanism of action for PANS and PANDAS, the antibodies are crossing through the blood-brain barrier, getting into the brain and affecting the basal ganglia. So if we can strengthen the cell membranes, we can make the blood-brain barrier stronger and more difficult to cross. So have lots of other great effects as well. A key supplement. These are sometimes hard to get kids to take omega-3 fatty acids and really hard to get enough in foods. So kids, adults. I mean, this is one of the supplements I use for my family and also for most people I see. I mean, with pandas, without pandas, whatever's going on, a lot of heart health. Food sources are walnuts, flax, salmon, and the fatty fish, the little fatty fish like sardines and anchovies, which are hard to get people to eat. So for most people, we need to supplement. This company Barleans makes a whole bunch of different flavors. They taste like little fruit smoothies, usually pretty good. You do have to use good brands. This is one supplement that I'm pretty picky about what brands you use, because you want something that definitely does not have high mercury levels. It has to be well-sourced fish. So psychiatric symptoms in pans and pandas are, as we've talked about, likely caused by inflammation. And so they're not likely to respond well to psychiatric drugs. These children frequently have very atypical responses to psychiatric drugs. Studies have reported increased levels of activation, hyperstimulation, and worsening of behavior when given SSRIs. I mean, I've had 2 children who I've worked with, and they were seeing, of course, other psychiatrists and their other doctors who have, kind of doing okay with pandas and then started on SSRIs and end up with psychiatric hospitalizations. And it has been documented in studies as well. So if they are used, they need to be used at really, really, really low levels, started very, very slowly, and be really careful. So I recommend a great deal of caution with any use of psychiatric drugs in children with PANS and PANDAS. And there are some alternatives, such as amino acid precursors, which I'm gonna just briefly mention here. They really should only be used for kids over 12. And I would really suggest, working with a doctor to do this, but there are options. You can also use OPCs, which are really just extracts from plants. They're flavonoids and polyphenols, which are like the bright colors that are in things like blueberries and the skins of grapes. And they're wonderful. They help as anti-inflammatories and antioxidants, and they've been studied in ADHD again, to decrease inattentiveness and to improve distraction and improve focus. It's kind of hard to take a whole bunch of them at once, but this particular brand has a good combination that's pretty well tolerated. You can also, again, use dark chocolate, almonds, nuts, blueberries, grapes, spices, and green tea. Let's see, we're kind of headed over on time. I want to be respectful of the time. I will just briefly mention that something else to think about and look at is our microbiome. Really can't have a talk on integrative or functional medicine without talking about the microbiome at this point. And especially in our children, who so many of them are being treated with antibiotics, we're affecting the microbiome. I would really suggest taking a look at to see if you have overgrowth of Clostridium. It can be tested in an oat test, a organic acid test, or breath test, also stool testing. And then there's supplements and dietary changes that we can help to treat that. The same is to be said with yeast overgrowth. And especially if you're battling mold as well, we see a lot of yeast and mold coming together. But the yeast is really tough, because so many of the symptoms of yeast overgrowth are so similar to the same types of symptoms that we're seeing with PANS and PANDAS, with the hyperactivity and the mood swings, memory problems, attention, sleep, all of that. So we need to take a good look and make sure that we're not having a yeast overgrowth. And if we are, there are ways to treat it. We can treat it with some probiotics, some other things like undeclinic acid and Candix. Coconut oil can help, but often we actually need prescription medications. And as an integrative medicine doctor, I don't just do holistic or alternative. I do a mix of both. Kind of the method is whatever is going to be most beneficial for the patient with the least amount of harm. I think I skipped a slide again, but I just wanted to kind of end with that understanding that PANS is really, really stressful on the family, and remembering that it is a medical condition and that the behaviors that we are seeing are because of our child's medical condition. And really listen to your gut. You know what's going on. Keep advocating for your child. And also, when you're frustrated and having so much difficulty with your child, try to not be critical of their behaviors. Try to remember that they are a medical condition. And then the practicing of mindfulness and mindful forgiveness, letting go of anger and frustration that we have to deal with this condition, can be really helpful for ourselves as we get through this, and also for our children. A study in 2016 showed that caring for a child with PANS is more stressful than caring for a person with Alzheimer's dementia. So really give yourself a break. This is tough. This is really tough. Ask for help. This is a great resource if you're getting the school involved. If you need to get an IEP or get a 504, I really recommend using this book. If you don't have a lot of support from the school, this can really help. And then I just have some resources. And yeah, these are a series of books that I really love. Lots of families have had a lot of success with them. You know, there's super, super long wait lists to get into cognitive behavioral therapy or to get help from psychologists. And this little book series is kind of at-home CBT. And, you know, kids seem to be pretty open to giving them a try. Those are those books. And then just, of course, referral services. You know, this is a real condition. You'll still hear people say that it's controversial, and it's not. You can remind the doctors that you're seeing of all of these incredible academic institutions across our country. And they just keep opening more and more. One of the newer ones is at Dartmouth now. And you know, thankfully, the research and the doctors treating this condition is increasing. So thank you very much. I hope that was somewhat helpful. I think I kind of sped through some of it, but I'm open to questions.
Thank you so much, Dr. Williams. That was really a great overview of all the integrative stuff and nutrition and everything. We did have one question come up in the chat just now. Which was, can you speak about adults with PANS? I was told by one health professional that it gets better in adulthood, that it is only a childhood issue, but have heard from others this is not true.
Yeah, I mean, I think that it, you know, unfortunately does carry through to adulthood. We have, especially if it's not treated, you know, if it can either, I don't know, you know, it can perhaps occur in adulthood. But sure, if it's not treated, then it will continue to adulthood. The initial studies and the initial definition, which many of you may be familiar with, by Susan Swedo, you know, she really defined PANDAS in prepubescent children, so in children before puberty. When they made the defining criteria of PANS, we removed the criteria that you had to be prepubescent, but a lot of that idea that it had to happen before puberty is, you know, still sticking around. You know, but no, it happens. No, I have one really like crystal clear PANDAS case that began in a 20-year-old. So, you know, an adult, and it was a child who had no neuroatypical, no mood disorder, like nothing at all. It was a really incredibly dramatic change as a 20-year-old with a onset of strep. It was just strep pharyngitis. It ended up being a not treatable strep, full flares of PANDAS, and persisted for a couple years without complete treatment. That child ended up, well, an adult. By the time they were 22, they had a tonsillectomy, and along with all of the rest of the typical treatment, they never had IVIG, but complete recovery. You know, So yeah, it's a difficult question to ask. You'll have a lot of people denying that it exists in adulthood, but I believe that there's a lot to do to help adults who are still suffering and haven't been treated. I don't know if that's helpful or answers that question. And yeah, Emily says that we have an ICD-9 code, and that is fabulous. Yep, it's a real condition that we can code.
If anyone else has questions, feel free to unmute yourselves, or even turn on your video.
Yeah, turn on your video. Feel free to ask anything. We're a little over time, but I have a little more time. If anybody wants to leave, of course, feel free to do so.
There's another question in the chat that is, can the curcumin by pure encapsulations be taken by kids under 12?
Yes, that can be taken by kids under 12. Yep. Yeah, let me go back to that. I'll pull up the slide for it. Yeah, so this one, unlike, whoops, goes as soon as I click. Yeah, so it is a combination of curcumin, which is definitely safe for kids under 12. It's a wonderful, it's a root. It's turmeric. Curcumin is the active component in turmeric root, that really bright orange color. It's what gives mustard its color in a lot of Indian foods. And then it's using pine bark and green tea and blueberry extract and grape extract. They say to go with 2 pills a day, like 1 at breakfast and 1 at dinner. In younger kids, I'd start out with 1 and see how you do. And there's often a good benefit, but if you don't see any change after 3 months, then not worth taking. The guy who invented this stuff, or who formulated it, I guess he didn't invent it, but James Greenblatt, he's the author of that book that I recommended on ADHD, the Finally Focused book. And he formulated this for pure encapsulation because, he was recommending all these different products these different supplements, and then combined them into this. I've never used the OPC3. I just wanted to put in another brand, to not be favoring one brand over the other. So I'm not familiar with that brand. Okay, let's see. Jessica says, what about kids who have bad reactions to things? Vitamin D, several types of magnesium, fish oil, bad dreams, behaviors. Is algae an omega option? Well, so I'll start with the easy part of that. The algae, or like a krill oil, is definitely an option, especially if people don't tolerate the other types of omega-3 fatty acids. I don't really strongly recommend it, only from a sustainability for our oceans, because krill oil it's hard to make, it's hard to get, it's not nearly as available. But yes, it's actually excellent to use for the individual, just not great for the environment and the oceans and the fish. But it can be, and especially if your kids are not able to tolerate other types, then it's a good option. As far as kids who have bad reactions to all these things, so, we're talking about an autoimmune disease, and so their immune system is flared up. It is on fire. It's reacting to everything. We very often have to take a huge step back and figure out what's going on, usually in the intestines. So if somebody's reacting to everything, they very often have leaky gut. And if you're familiar with that term, so they've had some inflammation in their gut, and that has allowed larger proteins to get through the endothelial linings in the intestines and to produce immune responses. So they start reacting to everything. And so, I mean, it's a whole other talk in itself, but with bad reactions, the first step is going to intestinal healing. So taking a look at stool samples, taking a look at organic acid testing, finding out what's going on in their intestines. Because they're going to produce antibodies to everything. And once you can heal the gut, which can take a really long time. A lot of these kids have SIBO, small intestine bacterial overgrowth, that leads to leaky gut. And, but once, if you can get the gut healed, then you can start using other supplements. It's hard. It's very hard, but it's not impossible, and you can do it. And it takes a long time, takes a lot of effort, but it can be done. If that answered your question. So let's see, any recommendation for probiotics to work with prescribed antibiotics and naproxen? Where did I talk about probiotics? I kind of glossed right over that slide. Okay, so here, when I just mentioned the microbiome a bit, we want to use probiotics that have, the best thing to do is to check. We never really know, especially after we've been using lots of antibiotics. We don't really know what our kids' gut microbiome looks like. So we can do tests to find out. But those tests are expensive, and so sometimes they're just not feasible to do. A lot of doctors don't order them. So using probiotics that have colonies of lactobacillus and bifidobacterium are really the best ones to do. There's a lot of theoretical, people talk about not making sure you don't use probiotics with strep. I don't know if it causes a problem or not, but I definitely avoid it. I've seen kids that I think react to it. So I look for brands that just have lactobacillus and bifidobacterium. This one is good. It's one of this kid's probiotic love bug. It's one of the few I've been able to find that's a chewable, especially if you don't have a kid who can take capsules. You can open the capsules, but especially with probiotics, the acid in the stomach, they're not as reliably getting to the intestines. So but with this chewable, they do show that they do. The other really important thing is not just giving probiotics, but having foods that help to feed the good bacteria. And again, I know that feeding these kids is hard, but trying to do things to increase dietary fiber, specifically using PHGG, which is partially hydrolyzed guar gum. I love this brand that I show there, Sun Fiber, because it's like tasteless, it's white, and it dissolves super easily. Kids don't know that it's there at all. It disappears. And then using MCT oil is also really helpful for the gut bacteria. For adults and people who can use capsules, I love the spore biotics, like anything that's actually coming in a spore form. So there's one called Mega Spore, which is great. There's Terraflora. Terraflora has kind of a lower amount. It has less colonies of bacteria, but it has a lot of prebiotics with it, like the fiber and the inulin and things that help the good bacteria to grow. It's always best to look to try to see what their gut really looks like. But if you can't look, then starting with just a good one that has lactobacillus and bifidobacterium. So let's see, you're trying a protocol of inulin and California grade olive oil. Well, I'm definitely using inulin. I have not heard of using olive oil specifically for gut. I love olive oil. Olive oil is a part of the anti-inflammatory diet. Certainly not using other vegetable oils, not using like corn oils for sure. Like olive oil is my favorite type of cooking oil. You just have to be careful you don't get to really high temperatures. But I'm not familiar with using it specifically for gut healing. Now, coconut oil and MCT oil, what MCT is, medium chain triglycerides, using those oils for gut healing, I'm more familiar with. Well, I don't see any other questions.
Hey, there's one more that just popped up.
Okay, let's see. Somebody asked, do I ever have children gain weight and have an overall look of inflammation? The face looks very Cushingoid, like presentation with abdominal swelling. Let's see. I'm trying to think if I've seen anything like that. I mean, I've seen a lot of kids gain a lot of weight because, very often they're, you're all familiar, like very often they're using other psychiatric drugs and they end up being put on the neuroleptics, which have high amounts of weight gain. So I do see that quite a bit. I mean, so we don't, I guess I haven't really seen that a whole lot other than when I've seen it caused by the drugs. But if they're looking Cushingoid like that, like I would 100% want to check their cortisol levels. And of course, I see this a lot in adults. I just don't see it in this kid's population, but in adults. So you want to look at the cortisol levels, and doing a blood test of cortisol is like a starting point. You can do like an 8 a.m. fasting blood test. I mean, I would for sure talk to their primary care doctor about that. That's something that is a more conventional base. And if that is low, then you have, or if that is very high, then you have somewhere to go. If it's normal, it doesn't tell you that much because cortisol fluctuates throughout the day. So it's really helpful to do a salivary tests or urine tests for cortisol. And there's companies that you can do that where you're testing it 4 times throughout the day. You test it at waking, and then a couple hours later, and a couple hours later, and then at bedtime. And you can really see why they may have a Cushingoid presentation. But yeah, I would strongly recommend, having the doctor look at that much more carefully, because that can be an indicator of something else. I mean, once you have, and like, it's not surprising, like we've said already, like once you have one autoimmune disease, you are so much more likely to getting another. So they could be getting Addison's, which is, low steroids, or they could be getting Cushing's, which is high. You can go either way. You have to have a higher index of suspicion for any of the other autoimmune diseases. So let's see, Kathy asked if REM disinhibition be a way to help determine, yes, it is. Susan Sweeto, I've heard her talk, and you guys all know who she is, right? I've heard her talk about if you have cases where, you really need a definitive diagnosis and you need it to get IVIG covered or something like that, then that you can do a sleep study. And even if you don't have that, like, even if that's not the only reason, a sleep study, I actually haven't ordered in a lot of kids. And because of the type of practice I have, I do a consultative practice. So a lot of times I'll suggest that they go back to their primary care doctor or go to the ear, nose, and throat doctor and get a sleep study. But the sleep study can indicate a lot of things. You can find out if they're having problems with their tonsils and their adenoids. So it's something good to do. And then if you end up seeing the REM disinhibition, the REM behavior disorder, like, yes, it is, it's a really huge indicator, because there's just not other things that cause that except for Parkinson's. So, yeah. So do I treat Lyme and tick-borne infections? Well, of course. I mean, I live in Pennsylvania, and we have such incredibly high rates. So I'm certainly not as knowledgeable with Lyme. I've had Lyme. My daughter, who has pandas, also has had Lyme. I had very, very severe Lyme. It's actually what brought me down the path of integrative medicine and kind of out of conventional medicine myself. So I have a lot of background in Lyme, and I do treat people with Lyme, but I'm definitely not like a Lyme specialist. So, yeah. But it's such a part of all this. I mean, all of these illnesses are so overlapping, and so often, once our immune system is dysfunctional, we get all of these different infections. So we see kids who have pandas, and maybe it initially started out with strep, but now they have Lyme, now they have mold, now they have yeast. It's tough. So yeah, I do consultations. I, of course, don't do any primary care. I require that anybody I see have their own primary care doctors. I like to be involved with the primary care doctors, and can do, kind of collaborate care is the best way. Let's see, does integrative medicine support tonsillectomy? Well, integrative medicine supports like doing the best, whatever the best, the best thing is available for that child. So, there's only been a couple studies on tonsillectomies and pandas, and they're not like overwhelmingly positive, but they're actually pretty good. I mean, there were really small studies. Like the one study I think had only 9 children, but 4 of the children like had complete recovery. And then, I don't have it right in front of me. I forget, like one of a couple did better. So, I'll talk with the ear, nose, and throat doctor and talk with the primary. And, especially if you have another indication, like if they have sleep apnea or they have these really huge tonsils, then you have another reason to do it. I mean, I don't have a straight protocol that I'd recommend for everybody. It's really very individually focused. Okay, well, thank you very much for having me. I think we can say goodnight. It's getting a little late for everybody. I appreciate your attention, and
thank you so much for coming